It's a great honor and joy to welcome a most incredible person who has put her shoulder to the wheel of bringing light to health. Dr. Gordana Markovic, who is an active proponent of integrative medicine. And just for those listening, a medical doctor specializing in social medicine and public health, principal professor of the postgraduate certificate in Ayurveda at the Alma Mater Europaea University, Maribor, Slovenia. Dr. Markovic serves on the State Expert Committee on Complementary Medicine, contributes to specialist education at the University of Belgrade, and is Southeastern Europe's leading practitioner of Maharishi Ayurveda. And I understand that you have published over 50 articles on Maharishi Ayurveda. That's impressive. So, very warm welcome, Dr. Gordana.
Thank you very much for the invitation and for the opportunity to speak about our program in Maribor and my personal practice.
Beautiful. So I have a question for you right away, which maybe those who are connected would feel the same. After students have finished the Maharishi Ayurveda training at Alma Mater, are they able to apply the knowledge to their patients and clients?
Thank you very much for this question. Sometimes we receive requests from TM centers or national offices about the competencies of our participants who have finished the course. And I would like to emphasize that at Alma Mater University, participants have many exams in phase 1 and phase 2, including tests, case studies, and oral examination. Also a very comprehensive final exam that includes a full consultation with a real patient. And only after finishing all these steps do they receive the certificates. So they start with practical work with patients from the first in residence block in Maribor. And after that, they must do case studies at home and present them during our webinars. During almost all in residence days, they have real patients and they have opportunity to follow their progress during our training, which means that whenever we are in Maribor, patients come for a control checkup, and that way our participants receive feedback from the patients and see if we need to change something in the treatment or how to start with the next step of the treatment. So they work together in a small group. At the beginning, we observe everything, and at the end, we discuss together and create the treatment. So I think this is a powerful experience for them and gives them great self-confidence. However, patients are also very happy, and I have to say that now, after 5 years of having our course in Maribor, we are very popular there and have a list of those who want to come for free consultations. So the great TM teacher from Slovenia, his name is Mr. Tomasz Klojčnik, and he is Deputy Secretary of the Alma Mater University. He actually helps us to organize everything and to have Maharishi Ayurveda training at the Alma Mater University. And I can say that I'm very proud of our practical work, which after the theoretical part is an essential reason why our participants are indeed ready to start with personal consultations after finishing their course. Sometimes I joke with them and tell them that I do not want to hear that they did not do everything correctly, not only because of their reputation, but also because of mine, because I'm one of their teachers. But I have to say that I'm really very proud of them, and so far we have had participants from more than 30 different countries, including Australia, South Africa, the Uganda, the UK, Ireland, Lebanon, Sweden, Norway, Hungary, and many others. So we can say that we have already made a fantastic worldwide network of many new Maharishi Ayurveda practitioners. But what I would also like to emphasize as a teacher, as one of their teachers, is that all the time we emphasize how important it is to keep the purity of Maharishi Ayurveda knowledge in their practice, how important it is to respect the holy teacher's tradition, how important it is to incorporate the wisdom of Maharishi Ayurveda in their personal life and have the highest moral and ethical criteria. And how outstanding support for all of us is a regular practice of transcendental meditation. And they really understand this and as an important step for the safe and successful practice.
That is excellent, because that's our absolute basis, the first prescription for health. And I wanted to ask you, what is the feedback of your students?
It is not easy for me to speak about this as the principal teacher of the program, but we already have many very positive recorded testimonials. Participants are mostly very satisfied and emphasize that the program structure is very good. I have to say that we made the syllabus based on classical Maharishi Ayurveda education and included the specific topics from Maharishi aromatherapy advanced courses, Sukshma Marma therapy also. I can say that they love it very much when Dr. Walter Melk gives online lectures. They told me that he's like an encyclopedia, and his knowledge and the way of his teaching are so fascinating. Also, Dr. Rainer Bicha comes and spends the whole day with us whenever we are in Maribor. He teaches about how modern medicine explains Ayurveda, and this is one very significant experiences for them because they can see confirmation from contemporary science of everything we teach them.
Yes.
They also appreciated all the other teachers and their knowledge as well. But I think that the practical part with patients is actually essential to our training, and they recognize it as a crucial for future implementation and practice.
Beautiful, beautiful.
Yes, maybe I can add that besides that, besides this, they spend many days together from morning to night, and also developing a fantastic friendship and supporting each other. And that way they also create a strong support network for themselves, because they continue with consultations and discussions between themselves even after finishing the course. So
yes, this is the sign of I would say, in any course, if you have good course relations, it's a very strong foundation for the future, for building referrals and also keeping them in line with the purity. It's just very, very nice that you mentioned this. And I wondered if we could go to you personally, if that's okay. What is your experience of practicing Maharishi Nadi Vigyan, the pulse?
Yes, for me as a doctor, learning about pulse diagnosis is one of the most important things I learned after finishing medical university, and it expanded my horizons to what is possible when using Maharishi Ayurveda in conjunction with the Western medical knowledge. When we feel the pulse, we know exactly what the person sitting across from us is like, what his potential is, and what his weak spots are. So we have opportunity to recognize what kind of imbalance he has in the physiology, sometimes even before developing of symptoms, and to give recommendations to prevent developing of disorders. So we see the patient, understand him, and accept him just as he is, which is the most beautiful part of this process for me. And when the patients feel that he is seen in all his authenticity, it also has healing effect. Recently, one lady came for the control checkup and told me she could not wait to come because she thought I was the only person who could understand her without criticism or blame. And yes, acceptance is very important. So
It's the most powerful healing attitude, actually. When you go to your doctor, that's what you expect, not judgment, acceptance. Very beautiful. And now this is quite interesting, because as Maharishi Ayurveda and medicine are integrating, then you have a perspective into both areas. So could you comment on which medical conditions do you think Maharishi Ayurveda is especially helpful?
In Maharishi Ayurveda, we do not only look at the condition, we look to the person. So we can give recommendations for any imbalances. We just need to explain that the effect will depend on the level of imbalance, of how much they are open to receiving this knowledge, and how much they are willing to integrate it into their everyday life, etc. So maybe I would like to say that some of my favorite topics are infertility and reproductive issues. And I have had many patients with these conditions. And, you know, for me, there is nothing better than hearing that a woman has conceived naturally after several unsuccessful IVFs. But no matter what type of conditions they have, when they come for the control checkup, even with a slight improvement, but with a smile, with better digestion, with better sleep, with shiny skin, and with better life quality, I'm really delighted and more grateful for the opportunity to have knowledge of Maharishi Ayurveda as a part of my personal and professional life.
Beautiful. And it goes without saying that immunity, natural immunity, improves for everything.
Absolutely.
That's a really important thing.
But for good immunity, actually, we need good balance in our physiology.
Exactly.
So this is crucial. Yes.
Beautiful. And how do you integrate the Maharishi Ayurveda together with modern medicine in your medical practice?
When I went through my first Maharishi Ayurveda training for health professionals, I felt like I had new eyes. And it was like I got the opportunity to gain insight into the problems my patients came to me with, and to understand what is going on in their physiology on a much profound and deeper level. So this enabled me to offer a much more complete treatment in general to my patients than when I practiced Western medicine only. But I have to say that I was very lucky, because my first teacher was Dr. Wolfgang Schachinger, and his way of teaching actually was absolutely perfect for me. You know, I have studied medicine because I wanted to be a surgeon, and I completed a master in emergency surgery in polytrauma and heavy trauma. And I really needed evidence for everything we were learning, and Dr. Schachinger was so patient and gave fantastic explanation for everything I asked him. So I believed him and immediately started with the implementation of Maharishi Ayurveda knowledge in my practice. And now, after many years of practice, it is so natural to combine Maharishi Ayurveda and Western medicine. I always start the examination with pulse diagnosis, with Nadi Vigyan, and actually with Ayurvedic consultations. Still, if I think that some lab analyses have to be done, or a colonoscopy, or echosonography, or anything else I deem necessary, I send them to do this.
If a patient comes to you and for consultation, for usual medical checkup, then you would probably say something like, you know, there's another approach, holistic, where I can take your pulse as a part of the diagnosis. Do you start like that?
Yes, I always start like that. And
yeah, beautiful, good. And of course, the patients are probably delighted at the insights, as you mentioned.
Yes, and as I said, this pulse diagnosis, this is special connection. I remember when I heard for the first time Maharishi's tape, and he explained how with practicing pulse diagnosis, actually doctor from the level of his consciousness make connection with consciousness of the patient. And pulse diagnosis is really amazing and really has a healing effect also. So this is a very special way for all medical doctors to start with examination. You know, this is very specific very special way for starting.
I think this is excellent. And in closing, any comment about your collegial relationship working with Brahmachari Dr. Girish Mamaya?
I'm very happy, and it is honored for me that he supported us and he supported our program, and I'm very grateful because of all support that we received from International Maharishi Ayurveda Foundation, for other colleagues, medical doctors, but especially from Girish Mamaya. It's really very special feeling for me, and I'm very thankful.
Beautiful. And a last health tip to all our listeners all over the world. Any one last tip you can give them for health?
As it is very important to have regular practice of transcendental meditation, because if we understand that cause of our physiology is in our consciousness, of course, first we have to purify our consciousness and then to have chance to improve our health in general. After that, we can apply all the other recommendations. But I think this is crucial for me as a person, and of course, this is crucial recommendation from me to my patients.
Beautiful. Very good. Well, very, very warm thank you for what you're doing.